I was working on a highly visible gubernatorial race in New York City. And 2 days before the end of before the election day, I had a psychotic episode. The Melissa Project came in and advocated for me when I was literally out of my mind.
My life was a mess. I was in and out of alcohol and drug places, hospitalized many times. I've been with Melissa's project probably 5 years now. It's nice to know you have support from somebody when some people don't have anything.
In January, it got down to about 0. I had 9 blankets, but I had about 9 blankets I covered with. It's a great program. It's absolutely great.
I was in abandoned houses. I was in all kinds of bad places. If there was no program, I'd be lost. I'd be a lost person.
That the Melissa's Project works. It's unlike so many of the programs that are presented where they're speculative, where they represent a dream or a hope. This is past the dream and hope level. This is at the point where the dream has come true. It's worked out in the fashion that was originally intended and is providing tremendous relief to virtually every person that it touches.
We have these tremendous numbers of satisfied clientele. We show a dramatic decrease in incarcerations, and that's the direct result of a dramatic decrease in arrests. None of our clients are homeless. Homelessness is directly linked to criminality, etc. That number has dramatically been reduced.
The earliest figures for me are the most compelling. We took sample cases, 10 sample cases. If you want to measure it in dollars, it was hundreds of thousands of dollars saved in 10 cases.
If there were no Melissa's Project, there would be people in need whose needs were not being met. There would be more hospitalizations, more people having jail be a substitute for hospitalization. There would be people whose homelessness would become an issue, whose needs would not be met because there were nobody to oversee the services that were needed.
We are able to pull things together. We're able to work across disparate agencies. We're able to pull team meetings together when they weren't done before, and we're able to get results.
The problem that we had previously was that the conservators were lawyers, but they weren't trained in the mental health issues. We needed someone who could add that element to the mix.
They came in and said to attorneys, if you will be the conservator, we'll take the care management components. We'll make sure their bills are paid. We'll make sure they get good care. And we'll hold the providers accountable to deliver the care they need when they need it.
Melissa's Project makes the work time efficient so that you can serve the conserved person well, get them the help and treatment that they need, as well as do it in a time-efficient manner.
To use these laws in the way that they were intended to be used is absolutely clinically appropriate, and it works.
That's keeping me happy. It's added to my life. It's keeping me living, you know? Living in a happy way, not in a gutterball way, you know?
And they do everything they can for me, and I appreciate it.
I now have been out of the hospital for 4.5 years. And that's extraordinary for me because I used to be in the hospital every 3 months.
They've helped me a lot. I don't know where I'd be right now exactly, but all I could say is they definitely helped. And it would be nice if more people gotten involved with them.
I think we've got a lot of work to do, and there's a lot more people that we can reach, and there's a lot more things that we could do, a lot more people we could touch.
These are our family members, and we need to really support, protect, and really help them grow.